Who's got control on that end? Who wants control on that end?
Me.
Is it your car? Okay.
Yeah.
I thought it was your office and probably your computer.
Yes.
I'm going to pass control over to you.
Okay.
And you should have it now. Oh, look at that.
Something happened. Wait a minute. Yeah.
It went away.
It went away. What the heck?
I was showing my copy of it.
You need to go and get your copy.
Oh, are you seeing? Yep. Then you're all seeing my partner.
Yes. Yes.
And my
granddaughter. Lovely little family picture.
Oh my goodness, I'm so sorry. That's hilarious.
Okay, now you go to view.
Wait, no, I just go down here. Oh,
slideshow. Oh.
What?
No, you just need to go like. Sorry that we're taking, but
hold on.
We forgot about this.
Hey. Okay. Sorry, Kirsten.
Nope, that's fine.
All right.
Hey. There we go.
Okay, sorry about that.
Go ahead and introduce yourselves, and I will be quiet now.
Okay. Good afternoon. My name is Barb Rendles.
And I am Silvia Benitez.
And we're meeting today to talk about building relationships with substance abuse providers. And we're from the Integrated Services Project.
And now we cannot move.
Okay, there we go.
So,
oh, wait a minute.
Learning objectives.
I know, but why is it?
You just need to go here.
Okay.
All right. Okay, so we hope that we can transmit the following objectives. We have 3 learning objectives for this webinar. And number 1, as we have been talking in other webinars before, it was found a co-occurrence in survivor women with domestic violence, sexual assault, and substance abuse. The second one is that we talk about the importance of having specialized advocates in different fields such as medical, DHS involvement, crime, and of course substance abuse. And the last point is how to make this happen, how to integrate and promote these services in your community. So Barb, this integrated project was initiated by Professor Bill Downs and you, right, in 1997.
Right.
Can you tell me a little bit behind the story of this project? How does the idea of ISP research started?
Okay, so I was an advocate since 1993, and I had worked in the shelter, and I worked on the crisis line, and did court watch, and well, a little bit of everything, volunteer coordinating. And I met Bill in 1996, and he had come from Boston and had done research that was similar in Boston. He did research in substance abuse agencies regarding sexual assault and child sexual assault. And so I was talking to him about what I had experienced in working with people and working in the shelters, and I talked about, you know, there was a woman one time that I worked with, and she was in a very violent situation, and he, when they first got together, he just used marijuana, but then it grew into, he started dealing cocaine, and she started using cocaine to deal with the situation because she tried to leave many times and couldn't get away from him. And so she used cocaine for a couple years, and she said to herself, I am never going to get away from him if I don't quit using. And so she quit using, and then she left, and she ended up in our shelter that I was working in. And there was many experiences also where I had went and picked up a woman from the hospital, and she was talking about her abuser and her situation, and I could tell that she was using meth. And so I asked her about using meth and talked to her about how meth was preventing her from getting away from the situation and being safe. And and then we had many situations where women in the shelter were drinking, but they would say it was tea, and and it wasn't tea at all. You know, it was alcohol. And one time there was a joint that was just a half a joint of marijuana, so what you would call a roach. And so I went to the director of the shelter and said, I found a roach in the living room. And she said, oh my God, we got to call pest control. And I said, no.
So the lingo was not there.
She didn't know.
She was missing some lingo.
Yeah, and I come to find out many of the people I worked with didn't know. And so I set up a training with a police officer who could show us the different types of drugs and the different paraphernalia and stuff so that people could recognize it in the shelter and stuff like that. So when I started talking with Bill, I was like, you know, there's a lot of substance abuse going on in the shelters, and I don't think everybody's realizing it. So that's how we kind of started the research, and he hired me on to do the research with him, and we actually did the research in 9 domestic violence and sexual assault programs and 7 substance abuse agencies.
Okay, can we show some of the statistics, and can you tell us a little bit about what we're seeing here?
Yeah, so in the substance abuse treatment, what we found, we asked them if they could tell us about physical abuse that happened within 6 months of treatment. So within the 6 months before they entered treatment, 67% had told us about physical altercations with their partner before coming to treatment.
Okay, next.
And then they also reported psychological abuse, and the same thing within the past 6 months, and that was 93%.
Wow. So women in treatment were 9 of 10 women in treatment had in the past month reporting psychological abuse.
Past 6 months before entering treatment. Yeah, and it could have been the week before they entered treatment. It could have been 2 months before, you know. And then, so then we asked about partner abuse in their lifetime, and 90%, like you said, 9 out of 10.
9 out of 10.
Yeah. And what I also experienced doing the interviews in the substance abuse treatment was that the women in substance abuse treatment had suffered extreme violence.
Like what?
Well, so, I mean, one woman was tortured. She was handcuffed to her bed, and he played Russian roulette with her all night. Another woman, he made her stand in a puddle of water and threatened to electrocute her for several hours. So stories like these, one woman was raped with a gun. So stories like these were coming from the substance abuse treatment.
So when you were doing the research and the interviews, you were able actually to talk with these women?
Yeah,
and ask them questions, and were they okay telling their stories?
Oh, yeah.
To you?
Yeah, I did.
Domestic violence?
Yeah, but the interviews lasted 2 to 3 hours. And
per person?
We asked them, and we asked them about their substance abuse and went through the ICD-10, and we asked them about, and we also did the DSM-4 diagnosis for substance abuse, and we also asked them about current partner, past partner, most violent, and the first partner ever.
So that's how you got into this
Yeah.
very important situation, because you had the right questions.
Yeah, and we asked them about sexual assault outside of partners,
Uh-huh.
and we asked them about childhood abuse from parents and child sexual abuse.
Do you see any women hesitating in telling you their stories?
No, and we
whether-
gave them the option that they could say they didn't want to answer,
And
and I really didn't have any trouble
By them?
with that. Yeah.
answering? Wow.
So, and then in the shelters and domestic violence and sexual assault agencies, what we found was 39% of the women had some type of substance abuse problem. 26% had a diagnosis for addiction to alcohol, lifetime diagnosis, and that's the international criteria
Mm-hmm.
for lifetime diagnosis. And then 35% reported not having a problem. Not that they haven't used before, but that they wasn't having a current difficulty.
So the 26% plus the 39 is actually the population of women. They're in the shelter that reported that at that time in the research.
Well, a couple,
Use
yeah,
and problems with their use.
and not just in shelter, but also in the domestic violence and sexual assault agencies. And the difficulty, I think it would have been higher. However, the difficulty was women who come and go quickly in the first couple days of shelter. And then we interviewed, most of the women were in some type of long-term support group.
Mm-hmm.
And so I think the numbers would have been higher had we been able to get people right away, except they're in crisis, and that was a difficult situation. So nationally, my experience and what people report to me is that it's about 80% of people in domestic violence and sexual assault receiving services from sexual assault or domestic violence agencies or in shelter.
Mm-hmm. So can you tell me about some of the stories from these women?
Yeah, you know,
some testimonies.
You know, that women say, and this is one woman's testimony, but a lot of women say this: I couldn't recover from substance abuse if I was still being abused, and because I would just go right back to using, because that sends you back to relapse, right? So, so it goes hand in hand, and it's hard to say that she would not be able to recover from one unless she addressed the other, and vice versa. And that's always what.
So they knew already the problem. They knew that
women did.
The women did.
Yeah.
The women, they had clear understanding on the correlation between their substances and their abuse, and why it was a difficulty leaving,
right,
and in recovery at the same time.
Right. And a lot of times people go back and forth about, well, if they stop using, then they can address their other problems. And if they address getting out of the abuse,
mm-hmm.
then they can deal with their substance abuse. But really it goes together.
Mm-hmm.
And it's hard to separate one. It's like the chicken and the egg. One doesn't come before the other, you know.
And we're going to talk a little bit more in depth about this matter, because this is a very important part for all of us to know, right? Yeah. So tell me about the process, ISP process. What do you mean by, what's the process here?
Well, what we did on our grant was that we tried to have a collaborative learning environment where advocates and substance abuse people teach each other. And that is certainly something that anybody could do, is go to the opposite agency and say, you know, let's do some staff education.
So after the research, right, that's
mm-hmm.
when you put together a list and said, like, okay, we know now.
Yeah.
We know now what we need to do to be able to help these women.
Yeah.
And that's what you're saying is, well, tell me a little bit more about what you learned and what's the objective for ISP.
Well, the other thing, and what we did find, because we had an outside evaluator program when we first started, and we did identify that it increased staff knowledge, that the educational program also created an environment where the partners got to know each other better, mm-hmm. and so then they could start integrating services after that. And we also had meetings where both agencies came together, so like the staff could talk about different issues with clients that they were having or difficulties, you know, without naming names or anything, but they would talk about difficulties they were having and ask advice and try to get assistance from the opposite agency. So, for example, if I was an advocate having trouble with someone who, you know, kept coming and going from shelter and couldn't stay in shelter because she was having problems, maybe I could ask the substance abuse folks, you know, how could I help her more, or how could you help me deal with that, so I can help her. And then at the end of the project, then they integrate services together, and maybe they do a group together or present in each other's ongoing groups or something like that. Like I could have a substance abuse counselor come to my support group and speak about substances and you know, how to deal with that, and vice versa.
I remember, you know, because I asked Bill about, well, you know, where is the name ISP, Integrated Services Project, you know, came along? How do you know? And he says, well, that's exactly what we do. We are integrating the services,
right?
You know,
it's more than referral.
Exactly, it's more than referral.
Yeah,
they are putting it together. All right, well, let's talk about the importance of service integration. I'm sorry. So, next one.
Whoops.
What happened?
Oh.
No?
It's where it pops up. No.
We don't have that one.
Oh, no, we don't. Somehow we skipped that one. Now we're on this one here.
Okay, so, but anyway, tell me, you know, we will go through each point, right? Tell me about.
So this is what, you know, the advocates have learned that in the medical environment, 37% of injuries are inflicted by a partner, and 40 to 50% of female victims suffer physical injuries. 80% of women report domestic violence to the police and visit the emergency room at least once. And so this was when, you know, because I've been an advocate since 1993. Mm-hmm. So this is when, you know, we started coming out with these statistics, and we started collaborating with the hospitals. Mm-hmm. And now we have hospitals with protocols to call us out when there's something, when there's a domestic violence victim. Now we have, for sexual assault, now we have SANE nurses, you know, and all those things that we hadn't had when I first started. This is what came along.
So how many years do you think that a specialized advocate for the medical field? How many?
Well, I think now I know a lot of advocates who maybe they're put in a clinic or some kind of women's clinic or something, where the advocate is actually there, has an office in that facility.
We have been moving, you know, pretty fast then, you know, because how many years you have been in the field? And
since 1993, right? So,
but really it's not, I mean, should be, you know, longer time, right?
Right.
But anyway, so what about advocates that are, you know, with information with law enforcement. And well, why?
Funny thing too, in 1993, we didn't even have mandatory arrest yet, right? That was brought up soon after I started, and mandatory arrest started, and then it seemed like both women or the victims and the abusers were getting arrested. There was a lot of a couple arrests, and so advocates struggled with that and tried to work with law enforcement to get something working there. And so so now we have DART advocates, domestic assault response team, that is the team with an advocate, a law enforcement, and the county attorney working together.
Can you talk about housing and the housing, because we have had now for a long time,
right,
housing advocates too,
right? And now we have transitional housing, which we didn't have when I first started, because approximately 63% of homeless women experience domestic violence.
Mm-hmm.
So, and now we know also that we need to go to the homeless shelters and work with the homeless shelters too. So that was something that came a few years ago as well, not when I first started.
We also have children advocacy.
Yep.
So that focus on the children.
Yep. And we have child advocates specialized to work with kids because 15.5 million kids in the U.S. live with families that have partner violence, and so we have advocates to work with them so that they have a way to talk about their experience as well.
And of course, it's important to have an advocate that focuses, on substance abuse.
Yeah. So now that we know that 90% of the women in treatment have experienced domestic violence, and we also know that about 70 or 80% of the women that see us as advocates have substance abuse problems also. We need to have advocates who are working with the substance abuse agencies, and even like our other advocates, maybe having an office inside the substance abuse agency or doing a group together or something where we work hand in hand with them.
And we're seeing this more often now, right?
Yeah.
That's great.
Across Iowa, we're doing pretty good.
So it is not enough. Why is it not enough?
Well, we've realized that referrals don't actually work very well, that it's a good idea to give someone a card that says here's how to get help, but then when they leave our office they don't go. And many times this is even proven in research in Illinois, where they followed the referrals and found that the referrals never showed up at the other office.
But I hear all the time, when I ask some agencies, not agencies, but directly, to some advocates or some people that actually receive women that have some challenges in their lives, like, no, but I do referrals. Like, okay, so what is a referral for you, right?
Right.
And a referral for them is I do have pamphlets and I have the cards.
Right.
So what did you find?
Well, since that's not enough, people are talking about warm referrals now. And so that maybe I know the substance abuse agency enough that I can walk right over to that agency with my client, or I can call the substance abuse agency and say, Marie, can you talk to her right now? Or I can tell her we're doing a group together on Tuesday afternoon. Why don't you come to the group? And then they will meet the substance abuse person there. Of course, open door policies means that shelter is open to having people come in when they're drunk or high, but they have to go to their room, and as long as there's no trouble, and they just sleep it off in their room, that it's fine. Mm-hmm. We have found some issue with that because now that shelters are starting to do that, which is good because at least they're safe in your shelter. But then it does cause problems for other women who maybe were abused by someone who was using. And so there is some difficulty with that. And so bringing some substance abuse services into the shelter wouldn't be a bad idea. And I hear a lot of advocates say, well, she can talk about it with me if she wants to, mm-hmm. But then what we find is that about 3% actually talk about it when they want to. And that's like probably 6 months later, right? Right. And the other 77%, or 67%, whichever one you want to say, don't say anything. Because it's substance abuse is not something we talk about, it's a secret. Just like we don't talk about sexual assault or domestic violence to other people. Mm-hmm. So, and that secret is not going to come forward unless you ask questions about it. So,
all right. So, I wanted to ask you a question about that matter exactly. When you said, well, they don't talk with their advocate unless the advocate actually asks about it. because it's a secret for them.
Mhm.
And they don't want to look bad, you know, in front of a person that actually is helping.
Well, you know, advocates have said for a long time that if a woman is using substances, she shouldn't have got raped just because she was out the bar drinking, right? So we don't want to say, we feel like we're going to be victim blaming if we say, was you drinking?
Mm-hmm.
But of course there's other ways to ask, you know, and so I would always ask about the partner's use, and then the follow-up question would be something like, did you feel that you had to use with him?
Mm-hmm.
Something like that, or I might have substance abuse posters. What I always had was a substance abuse poster in my office,
Mm-hmm.
and whenever I shut the door, then that substance abuse poster was really big, and it was right there in their face.
So that shows that you knew about substance use and domestic violence.
Yes. And so they felt more free to talk about it. They would even point out the poster and talk about it. So, and I guess I just had a way of talking to women about substances. I didn't ever feel like it was blaming. I felt like it was an issue that was there that nobody was talking about.
And we need to deal with it so you can actually leave if you really want to, right?
Right.
So what is what some women told you?
So these are from the area grant, which was follow-up research that we did after we'd been doing integrated services for a while.
Okay.
And so we went back to those agencies that was working together and asked clients there how they felt about working with their advocates now.
So they're working, so these women now, so let me just put that straight in my head. So you did the research and then you start working with the agencies and they start working with women together as an integrating services now. Yeah. And so you, after a while, you start doing a little bit more research. You went back to these women that were working with both, with substance abuse, counseling or counselors, and advocates at the same time.
Yes.
And this is what you found.
Yeah. They were doing groups together.
Mm-hmm.
And women said, you know, I felt comfortable with my advocate to talk about my use, and from the very beginning, and it didn't seem like a big deal at all.
Wow. Okay.
And then I wouldn't have mentioned my treatment unless they hadn't asked. I had no. Another woman said I had no idea that it wasn't my fault until the advocate came to the substance abuse group and said that he was always beating me up because I was drunk. And so it wasn't until the advocate came to that substance abuse agency and started talking about domestic violence there, and then she realized it wasn't her fault because she was drunk, that he was beating her up. Then she realized it was abuse. And this other woman said, I didn't use, but my boyfriend did. And in shelter this week, we just talked about it, and it was very open.
So it doesn't matter if an advocate goes and does a presentation, and if these women do not have substance abuse problems, well, in this case, yes, because they go directly, right?
The advocate goes into treatment.
But if they don't have, domestic violence problem, that does not mean, right, that she doesn't get information and
about future abuse. Yeah.
Or
the thing too, I think, is a lot of women in substance abuse treatment, they have finally broken off with their partner, or maybe they don't want to go back to their partner. And I've helped several women who didn't want to go back to their partner.
Mm-hmm.
So when I went into the treatment center, they said, can you help me go somewhere else? I don't want to go back to him, you know. And so now I realize he's abusive, you know, and so then I could help them, you know, get no contact orders or go to a shelter or start a new.
Very practical also then.
Yeah.
Okay. All right. So I would like to talk about lethality, you know, and so can you tell me how is that safety and sobriety goes together?
Well, while substance abuse does not cause violence, we do know that it makes the situation more violent and more dangerous. You know, if you have a perpetrator who is intoxicated, there's a greater risk for victims to be injured or killed.
Mm-hmm.
And if a perpetrator is on meth, that makes him a great stalker. It makes him very paranoid. So maybe he'll be more, his jealousy will get worse, which perpetrator's jealousy is really bad anyway. And then to increase it with like meth, amphetamine, where their paranoia gets worse, then, and they're stalking them day and night, and the victim cannot sleep, or the survivor, you know, cannot sleep, or is always being harassed and constantly in fear because he's able to stalk her at all hours.
But I also heard, you know, that when a perpetrator is using and survivors agrees to use with him, well, this also can lower the risk on him to start a fight, or it actually kind of creates a safe place for her to be. But on the long run, isn't it really safe? Because what she doesn't want is to start a fight. So if he pushes her to use, it's easier for her to say, you know, if I use,
She gives in because
you know, she gives in, right?
Yeah.
But is it how this does increase the danger?
Right.
You know, trying to find a safe place, but is it a safe place really or not?
Right. And that is the trouble, you know. You can start using with them so they don't get mad at you, but then eventually, the more intoxicated you are, the less likely you are to be able to control your safety plan. And your safety plan is going to go out the window. You either won't remember it, or you're not in the situation of the right mindset to be able to use your safety plan. You probably won't call the police because you're high, or intoxicated, and you don't want to get arrested also, and you're afraid if you do call that you'll be arrested. So for using, and I know many women who were sexually assaulted who I worked with were sexually assaulted within using drugs, and they didn't want to tell about that because they knew that if they told about that, they felt like they were using too, and they didn't want to tell the police.
Sure.
So all those things can be more difficult to either report it or stay safe.
So how does it increases the danger if you're using? How much do you think?
Well, we know that during, I told you that in the research we asked about the first violent incident, and the last partner they had, and previous partners, and so what they reported was the first violent partner they had, 68% of the time the abusers were using drugs or alcohol, and 31% of the time the victims were using. And then some women had 7 to 8 abusive partners, not all of them, but some of them certainly did. And so then when it came to the current partner that they have now, or just had most recently, 67% of the abusers were using, and 43% of the time the victims were using. So as the victims stayed in the relationship longer or had more abusive partners over time, the victims were using more.
Sure.
To cope with that, you know.
I understand.
Yeah.
So, and we need to understand also here that when actually man is using, then really there is no society rules. I mean, society rules don't matter anymore, right? Guilt and shame and ethics just disappear.
Right.
If they didn't do it before, because I listen to a lot of women saying, oh, well, you know what? This only happens when he drinks.
Right.
Right? But what I explain to them is, well, the society rules, and sometimes some shame or the ethics, or just, you know, is kind of a stop right there because they're sober. But when they are using, you know, then everything just disappears, goes through the window, right?
So, which could make him way more dangerous too.
Sure, because that's what, they want to do that then. So also women told us, right, that without dealing with domestic violence, it is often a trigger for them to go back to using.
Right. And, you know, a lot of times what I noticed was when I worked in shelter, the advocates would say, when she came for a couple days and then she left, they'd say, oh, well, it takes 7 times to leave your abuser, right? And they just figured she was in that cycle of going back to her abuser and coming back and going back to her abuser and coming back. But what I think they missed was that if they're talking to their abuser, he can tell her that he has some drugs for her, or he just scored some drugs or something, and then when has addiction issues, it's really hard for her to fight that craving.
Sure.
And also, if they're in shelter and they're not able to use, and they know their abuser has some, or he is a dealer and he was her regular provider, yeah, then it's really hard to stay away from him because I'm having the cravings for using.
So how can the advocates then can be more helpful?
Well, definitely to have a group together with the substance abuse agency, or have some avenue, maybe have a substance abuse counselor in the shelter or something, to have a way to address the substance abuse at the same time, so that we can be real about why we're going back to the abuser and what's happening.
Because it can be confusing if you don't really know the signs.
Yeah, and cravings are really hard to stay away from. Yeah.
Okay. So let's move on to the next subject. So what actually is?
So ICADVA has standards around best practice for dealing with survivors who have substance abuse and mental health problems also. And I don't know if everyone knows about these. I know some advocates are not knowledgeable about the best practice standards that ICADVA has.
Some very new also, right?
Yeah, they're new, or the directors know about it, but the advocates don't, or something like that, So there is several standards that ICADVA has. A standard 230 is that programs will strive to create a trauma-informed environment where survivors feel comfortable disclosing their needs and their concerns around mental health and addiction. Standard 231 is where staff need to receive training about mental health and substance abuse, so that they're more likely to help battered women. And the training should also include the committal process, which it takes 2 people to commit someone in Iowa.
Do you think that our websites also, or the websites, I'm sorry, our webinars here are actually fulfilling this?
Well, I don't know if we talked about committal, but we have talked about many of these ideas. Standard 233 is where programs will coordinate services with mental health and substance abuse to meet the needs of the battered women and their children. Standard 234 is to safety plan that includes mental health and substance abuse. And some of our trainings have included substance abuse safety plan and referrals to the community to get more support.
Of course, to receive more information and trainings, it's way better to have a relationship now with the substance abuse agencies, right?
Yeah.
Because who better than them training them?
Yeah. And we only problem we're seeing though is when we have turnover. When there's a lot of turnover, we have to keep training people. So that is becoming part of an issue.
Okay.
Also, ICADVA standards includes best practice. The program creates a trauma-informed environment responsive to the needs of survivors, which includes addictions. This is achieved through training in trauma and its impacts, including dissociation, survival skills, long-term individual and social legacies for all staff, and the creation of agency culture in which clients are regarded as injured people and not bad. And that certainly goes into addiction. The United States kind of feels like they have a war on drugs, and these people on drugs need to go to jail and all this kind of stuff, where what we understand and what substance abuse counselors understand is that these people have become addicted in their mind, and their mind is already addicted. It is not easy to get away from substances. They really need a lot of help and a lot of support.
Sure. So as an advocate, if I want to know more about best practices, where should I go then?
I would definitely approach the ICODFA website, or Kirsten may be able to help somebody get that information as well.
Okay. So after all the information collected, what was the strategy then?
So we met with the Substance Abuse Agency and the domestic violence advocates there at the same time to talk about co-occurrence issues and how to help someone. We think that if you ask for education, even if ISP isn't there, you can still do this. You can go to the Substance Abuse Agency and talk about co-occurrence issues, talk about getting some education for your staff. Maybe if you have turnover, you need to have new staff. You want your new staff to be trained. Maybe they could get in on substance abuse orientation that the substance abuse staff are doing, and they can get some more substance abuse information, and vice versa. You could train any of the substance abuse counselors that are new. Substance abuse counselors are, that's a burnout field also, and it has high turnover, and so they need more education as well. And offer training to their staff.
All right, sounds good. And I can see, that at the very beginning of this webinar, we talk about that there is specific advocates for law enforcement, and this is wise. It's exactly the same, right?
Right.
We know that actually these women are sometimes helpless, trying to find their path through what's happening to them, and it involves housing, or involves some crimes or police
Right.
officers. And what better if a person that knows about that field guides you, right? At least go with you. It's like, just like you said, a warm referral.
Yeah. And what I did as an advocate sometimes was, I had a client who was talking about struggling with substances. I would say, well, how about you come to this group that we have?
Mm-hmm.
And we have this group at this time, and it's free. You can come with me to this group, blah, blah, blah. And then she would go to that group, and then she went to that group. Well, one in particular, she went to that group a couple times, and then a week later, when I came to the Substance Abuse Agency to do a presentation in one of their groups, I saw her talking with a substance abuse counselor about getting into treatment.
Wow.
And then a year later, of course, she contacted me and said how much that I had helped her, and and along the way, I had helped her with finding an apartment and a new place to live, and she got her kids back from DHS, and and DHS makes you go, if you lose your kids to DHS, you have to go to hundreds of different appointments, and you have to do all these things by yourself. And so if we can integrate substance abuse and domestic violence services, we can work together to help that client too.
So what is the first step? If I am interested, in becoming that person to understand more substance abuse, then what is the first step that I need to do?
Well, we call it a sister agency, right? I would contact your sister agency, which means if I'm an advocate, I would contact my local substance abuse agency.
Mm-hmm.
And preferably a counselor who does women's groups, and ask if you can do presentations in their group about healthy relationships or something like that, or a sexual assault advocate can ask about coming in and talking about consent. Consent in the Substance Abuse Agency is a really big topic. The lines are blurred when you're drunk, and in substance abuse treatment, they don't really talk about that consent part. And so it's really good for sexual assault advocates to talk about that as well there. And then you can ask to do it on a rotation. So not that I just come in one time, but can I come in once every 4 weeks,
mm-hmm.
or once every, now it depends on the agency, but at one of the agencies that I worked with, I went in every week. And I would talk about healthy relationships one week, and I would talk about consent the next week, and I would talk about the effective kids on the next week. So I went every week, but not all agencies like that. So, but if you keep up a rotation, it'll keep going.
Well, and now with the services that we are providing, one of the things that we are seeing is that it does work.
Yeah.
And the substance abuse agency, they're very happy by having advocates there.
Yeah.
You know, they're receiving them and like, yes, they understand the need, right?
Yeah.
They're getting it.
Yeah. And, you know, we talk about it from a trauma-informed service. So we do understand that men sometimes are sexually abused as children.
Mm-hmm.
But we try not to talk about the power and control well in a mixed group. We talk more about healthy relationships
Mm-hmm.
and what healthy relationships are, and maybe we can show an example of what a healthy relationship is not. But the key is to talk about healthy relationships to both men and women there. And many times the substance abuse groups are mixed.
Okay, and that was, I was going to get there.
Mm-hmm.
A lady, or I'm sorry, an advocate that goes and provides presentations to groups, she is going to find that it's not only women,
Yeah.
but men that she needs to talk about. So
Right.
she needs to know exactly what kind of subjects to present
Right.
there, right?
Yeah, and I did find many times that there would be one or two men in the group that I could for sure tell were perpetrators by their reaction to our discussion. And so, you know, women are in treatment with men who, some of them are perpetrators. So
Mhm.
you do have to be careful about what subjects you're talking about.
But the idea is that when you're present and then there is one or two women there, sometimes what they do is that they actually go to you as an advocate, right? And what happens is that they go to you and then actually and then talking to the advocate saying, hey, you know what, I didn't want to talk directly, you know, to the group, but this is happening to me, what can I do? Right?
Yes.
That's great. So trauma, when we talk about trauma-informed services, and we, okay, can we continue? Sorry.
Yep. So, another thing you can do is ask the prevention folks from substance abuse agencies to come in and talk to the support group about substance abuse education. And prevention folks can go out and talk in the community. The counselors are kind of more limited. So prevention would be an easy person to get to come to your support group and talk. Or maybe to the shelter and talk in a shelter group or something like that. You can also ask for case consultation and have case consultation with staff, like at a staff meeting, or you could have a substance abuse counselor come, or a substance abuse supervisor come to one of your staff meetings and specifically talk about substance abuse issues that you're having with your clients at that time.
Mm-hmm.
You could also contact a local drug court. There's a lot of drug courts now, and even in Waterloo they have a domestic violence court now. So for us to be involved in the drug court also, just like we do in the domestic violence court, is also in working with the team that works with the domestic violence court, or I mean the drug court. Sorry.
So being present there in the same place where they're having the other service,
Right.
matters.
Right. Yeah. And like I said, also contact your local support group, maybe a women's group, and ask if you can present about healthy relationships and consent. The only thing is, you know, people want to go out to like AA groups
Mm-hmm.
or NA groups, and I have found that AA and NA are closed groups and they do not allow anybody to come in.
Mm-hmm.
But it could be that maybe there are some other kinds of groups too, like a celebrations group that we have here in Waterloo, but it's run through a church,
Mm-hmm.
and so they might let you come in and talk about domestic violence services or something there.
So it's easier really in your sister agency.
Really, yeah, where they do treatment
where they do
it's really
treatment
a lot
is where
easier.
they will allow you to get in, bring information, be there, around there, maybe once a week, or maybe, you know, twice every month, you know,
Yeah.
to do the presentations, or even if it is I guess if it's, well, it does not matter really the size of the agency, right?
No,
They
even
might
if they
even
do,
have you there for a couple of hours.
Yeah. And then maybe as you're working with them, you can talk about starting a joint group together.
Mm-hmm. Mm-hmm. Great.
Some of the examples of what we have across Iowa now is co-led groups where a substance abuse substance abuse counselor and a domestic violence advocate or sexual assault advocate co-lead the groups together. And even the sexual assault and domestic violence advocates, now that they're separated, they take turns each week, or maybe they'll do 6 weeks of domestic violence and 6 weeks of sexual assault in a 12-week group, something like that.
And then tell me a little bit about the public education. What is that?
Well, if you increase awareness in the community about both issues, what you can do is team up with the substance abuse agency. We had one agency that would go out in October. It's Domestic Violence Awareness Month, but it's also Red Ribbon Week for substance abuse. So they would team up there together and go out, and they would do tables together, or they would present together. We had one agency, the substance abuse prevention counselor was going out to bars and talking to people that worked at bars and the staff about if you see a person that's always drunk in your bar, you know, they need help with substance abuse, you can give them information. So they said, the staff at the bar said, what we see is people fighting. They get drunk and they're fighting with their partner. So they wanted to know more about that. So she brought in the domestic violence advocate, and so they could talk about partner abuse, and that she talked about substance abuse, and they talked about partner abuse to the staff of the bars.
So community needs to know that this is an issue, that these two issues are together, right? Goes hand to hand.
Yep. And they've done co-located services where an advocate is in the substance abuse agency and has an office maybe 3 times a week, or vice versa. And I think that, you know, one of the important parts about it also is to have some kind of policy and procedure about screening and expediting a person into an admission in a treatment center, because there's different criteria that they have. And so there are ways, for instance, if a woman is pregnant and using, or if she's shooting up needles and using, you can get them into treatment faster. And so, some substance abuse agencies say, you know, she's not safe if she's using and has partner violence at home. So that might be a reason for us to get her into services faster. Different things like that. So the more you work with the substance abuse agency, the more likely it is that you can assist your clients better. We saw around the nation people say, well, they have a long waiting list and stuff like that, but there is a way to work with them to get your clients in faster if they can find a reason for danger and that they're not safe in their household. They can get them into treatment faster. So.
All right. Well, we just have 5 more minutes, and I would like to talk about some challenges, because there's always, when there is something positive, is because we had challenges, right?
Yes. Well, and I think I mentioned this already, that staff turnover is an issue, that continued education for new staff is an issue. Finding funding for these things is difficult, so it's best to do it in a way that integrates with what you're already doing, instead of being something specialized. So
that's why the presentations come really handy.
Yes, yep, and also the substance abuse agency, if they have a women's group, they can create it, make it into a co-led group, and invite the advocate to come in and co-lead that group. And then it's already within the services that they're providing. So it's much easier to kind of get that going if you do something that's integrated into what you're already having services. So, and then, you know, I think getting past the difficulty of differing opinions about certain words or service provision is one of the things that we found was important. And so being able to have open communication about some difficulties that you're having with the other agency in a way that doesn't upset them. You know, to find out why is it that you do services this way. It doesn't seem like it helps battered women. You know, why is it that you call them this or that? Because it doesn't seem like it helps battered women. So
training on language.
Yeah, codependency was one of the big, you know, issues we had, and the substance abuse counselors don't like to hear that you call people perpetrators or abusers. You know,
because
that legal
they're
language.
Their clients, right?
Right. And they need to have.
They're providing services. Yeah. They don't want to be mean. Let's put it that way.
Right. They need
with
to
that
have.
Word.
Yeah.
When we call them all the time, the advocates, right? Like, oh, it's an abuser. It's a perpetrator.
Right.
Right.
And they need to have a little compassion for their clients to be able to help them. So yeah, they, you know, there's words that I don't like, and there's words that they don't like. So.
Yeah, I think, you know, that's one of the things that I saw the most is that sometimes counselors, male counselors, have more challenge.
Yeah.
Right, because they feel like we are attacking them. Women are attacking them all the time, and
yeah.
So.
And men get abused too. That's what they say a lot.
Right. Right.
Yeah. So another thing you can do, you know, is use some of these, get some of these books to read up on it some more, or see these movies that we have listed here. Maybe visit this website we have for the National Center on Trauma and Domestic Violence, Trauma, and Mental Health. They have a lot of good tools for you to use also. There's articles, several different articles that you can read that we have listed here. And there's 3 different curriculums that we have that you could use for groups.
If you need the curriculums like Blue Sky.
Well, Blue Sky is ISP has. Seeking Safety you can get online, and Real Tools by Patty Bland you can get from the Alaska Network.
Alaska Network.
Yeah.
All right.
So that's all we have today, unless you all have some questions we'd like to answer for you. Is there any questions then?
Give people a chance. I've been kind of watching it as we go, and there weren't any throughout.
Okay. We didn't really stop and ask questions in the middle, so.
That's okay.
Okay.
All right. Well, thank you very much for. Is there?
Thank you.
Okay.
Thank you very much.
Thank you, and see you on December 8th.
Yes, there's
the next one.
On December 8th if you'd like to come to that one. Yep.
Registration for that is on ICADVA's website, and thank you. You also got a thank you from participants. And as I said, this will be available on our YouTube channel soon. If I don't get it up this afternoon, I will get to it tomorrow. And please hang around and do the evaluation. So in order to encourage that, I'm going to sign us all off.
All right. Thank you.
Have a good holiday.
Okay.
Bye-bye.